Okay, I think let's go ahead and get started, and then more people can join us as we go through. We only have a half an hour together today, so I do want to optimize that. So for those that have just joined, for kind of the housekeeping types of things, if you have any sorts of questions or anything that you kind of came in with, so you have that, you are welcome to put it in the Q&A box. And then if you have any questions, of course, throughout the webinar today, you're also welcome to add that. If you do add that to the chat, I will see that, but we get to the questions in the Q&A first. So we will have time at the end of my part of this conversation to answer those questions. So as many of you are here for, you guys are here for The Art of Pharmacoeconomics, which is the new book that came out. And so we are just going to spend, so I'll talk about 20-25 minutes, and then we'll have the remaining time for questions. It might seem like I'm going through a lot, so if at any point you still have more questions, feel free to email our team and I can get to those. So welcome. Thank you all for your interest in spending this next half an hour with me. And so this is what the agenda is for the next about 20-25 minutes. So I'm just going to tell you a little bit about myself for those that are new and maybe haven't heard from me or seen me or heard of me. And so I'll just give you a little bit about myself. Then we're going to talk a little bit about resource scarcity and decision making, which is really the foundations for why we even talk about pharmacoeconomics, why we think about cost analyses in general. And then I will give you a very brief overview of what is pharmacoeconomics for those that are new to this topic, keeping in mind that there's a very diverse audience with us today, but the principles of pharmacoeconomics, the types of fundamentals that I'll talk about, are really pertinent across different sectors, mostly because of the whole resource scarcity and decision-making aspect of the need for this type of analyses. Then I'll briefly go over an overview of the book. For those that already have the book, thank you so much. Feel free also to add your comments, any first impressions or comments that you have about the book in the Q&A box as well. But for those that haven't seen the book yet, I'll just give you an overview of the different sections and chapters and what it has to offer. And then I'll just briefly discuss about who should read this book specifically. And then, of course, I personally believe that everyone would benefit from reading this book, but we just talk a little bit more in specifics as to who should use it. And then in the last part, I'll just talk about how to use the book. So we have the traditional setting, which is kind of like the learner setting as kind of a student. But of course, we all know we're lifelong learners in any setting that we're in. So we'll also talk about how you can use it in the professional setting and how it might be applicable to what you're working on. So here's a little bit about me. So my name is Rola Kaakeh. I am the CEO of Salus Vitae Group. I am the author of The Art of Pharmacoeconomics. I also am part of the faculty at Northwestern School of Medicine here in Chicago. I'm also affiliate faculty with the Institute for Global Health as well. I am a fellowship trained licensed pharmacist. So I am on the whole spectrum of this topic. I learned pharmacoeconomics both as a student in grad school, and then I did 2 years additional training as a postdoc fellow in pharmacoeconomics health services research from the University of Michigan. And that was in the College of Pharmacy, School of Medicine, and School of Public Health. So that just kind of shows you how much this topic kind of bleeds within different schools and areas, and definitely kind of the frameworks of that bleed into other sectors as well. So in my current role, I advise a wide range of institutions, as well as universities, corporations, consultancies, and startups and different associations on various topics. And my focus areas have been primarily national policies, but as well as kind of these institution-specific initiatives that really address specific topics such as access, delivery, and outcomes. So I'm very passionate about access to medications in general, but I'm also really interested in how we make decisions and how to best use evidence-based decision-making. So like I mentioned, being both as a learner within the formal settings of student to fellow, I also taught this topic within various universities on a graduate school level. So I've definitely kind of seen it from both the learner and the educator perspective. Now let's talk about resource scarcity and decision making. And I think this is something all of us think about, whether on a professional level or even on a personal level. So what does that mean? So if we start by thinking about resource scarcity, we know that there are limited finite resources, as well as these budget constraints. So we can't spend an endless amount of money on everything. And if we couple that with already that there are many items that are high cost or increasing in cost over the years, we kind of have this situation where it makes it very difficult to allocate resources or think about how do we best allocate resources. We also have multiple competing choices, which some would say that's a good thing, right? But if you couple it with the fact that you don't have endless resources, you don't have an endless budget, and you have all these different options, how do you begin to choose? So that's where we have to start thinking about allocation decisions. So that means what, how, and to whom we spend our time and resources. This is in the spectrum of healthcare as we're looking at it here. But again, this applies to everything. So that means we have to answer very difficult questions. Some might be kind of simple if it's about a specific initiative or between two options. And so then you start to think about how much am I willing to pay to solve an issue? How much are we willing to pay to save a life or extend life for a year? That's a much more difficult question to answer. Also, policymakers are asking questions such as what should policymakers and really society be willing to pay for an additional or incremental unit of health gain? Now, in an unlimited mindset, we would think we should pay as much as we can in order to save a life. But remember, we have to keep in mind that there is never a blank check in healthcare. There's never a blank check overall. So that means we actually have to objectively decide where to allocate our resources. And we think a lot about our decisions when it comes to clinical decisions to think what is the most clinically appropriate, say, medication or procedure or service. But then when you also think about how we're allocating our resources, we also have to think objectively as to what do we decide, which choices do we choose. And we know that when we are equipped with better information, we can more efficiently assign resources, which is the ultimate objective. Now, an overarching goal in general should be to provide more objective, evidence-based decision-making in healthcare. Now, to do this effectively, we need to understand our environments and how we're making decisions. Now, decision-making in general, again, regardless if you're in healthcare, in any discipline, is a multidimensional process. If we even think about the decisions we make as on an individual level, have you even thought about how you make decisions? Do you really understand and evaluate your own decision-making process, whether it's something simple or on a much larger scale if you're working on a project or initiative or on different policies? And have you ever wondered, are your decisions evidence-based or are they driven by other factors? Because we know decision-making, because it's multidimensional, we have to incorporate and we have to think through what is going through our decision-making process. Now, in the book, I talk a lot about decision-making because it's driving a lot of those, the need for these types of analyses in general. So in the book, you're going to find things such as decision criteria, decision models, decision questions, decision rules, decision trees, which is a specific methodology within that. I talk a lot about decision makers. So who are the types of decision makers? We have to keep that in mind as we're making these initiatives or these evaluations. I also created a decision-making questionnaire that allows you not only to evaluate your own decision-making process, but as well as those within your teams or institution or organizations. And then thinking about the whole decision-making process in general, because ultimately, if you have to allocate resource, you have to make a decision from which choice to choose. So that brings us to pharmacoeconomics. So what is pharmacoeconomics? So pharmacoeconomics is a type of outcomes research, which is a methodology that is very broad and holistic that looks at the end result and really the real world data of specific interventions. And it's a subset of health economics. So health economics in general includes many of the analyses that I talk about in the book. So whether you think about them in terms of pharmacoeconomics or health economics in general, there is several of those analyses that are used throughout. But what makes pharmacoeconomics unique is that it focuses on pharmaceutical interventions. So that's products, services, whether it's medications, technology, the actual delivery or medical technology devices. So it encompasses multiple different things. And it's used to inform decisions of resource allocation within institutions. So we had already mentioned kind of the need to better allocate decisions. So then if we dive a little deeper and look at pharmacoeconomics, it's thinking, okay, in the breadth of determining which medication to use, which service to conduct, that type of thing, we can move one step further there. Now, pharmacoeconomics in general has grown so much throughout the years. Several curriculums across different schools have now required this area, and specifically more on cost effectiveness, which this book covers. For the need of it to better allocate these resources. So we've seen it grow, the number of studies have grown, and then the quality has also improved. So by that, it means that you are more likely to now read these types of analyses and have them incorporated into your decision-making process. Now, the demand to conduct and understand pharmacoeconomic analyses has really grown out of the need and pressure faced by decision makers, professionals, and healthcare providers to really quantify and justify the value of products and services available or provided. Now, I want you to keep in mind that pharmacoeconomics is not the silver bullet. It is not the only analysis that is used to make a decision. It is one of many, but it is used to allow decision makers to evaluate both the costs and patient health outcomes. Because many of us within the healthcare space are so focused on the clinical health outcomes, which makes sense, right? But then there's always a cost associated with anything. And so as we start making these allocation decisions, we have to look at it from both sides. So the information that is generated from these analyses can actually be used to make decisions on a patient by patient level basis. So for those that are healthcare providers that are really thinking about how do I choose one procedure, process, service, or product or medication over the other, but as well as national policies more on a global scale, depending on who the decision maker is. Now, pharmacoeconomics in general plays a role in the evaluation of products and services. Kind of that's the overall arching, goal or role of these types of analyses. And it is used as a tool to assist in what is highlighted here on this slide. Because like I mentioned, it is not the only tool that is used. So you add it with whatever it is that you're doing and supplement to think about these different, to think about your different options and how you're best making decisions. So it's used in things such as the coverage policies and benefit design. It's used in formulary management decisions, as well as pricing decisions of medications, the drug approval process, it's also incorporated there, and developing drug use and treatment guidelines, as well as disease management programs. Also, we do have a global audience with us, and so I want to keep in mind that this is also pertinent to global audiences. Now, depending on where you are in the world, you use these analyses to various degrees, but the availability and the need to understand and evaluate these are really important. Now, many of you will not be conducting these types of analyses because they're very time consuming, but understanding all the components that go into them will allow you to better evaluate these types of analyses to see if something is truly cost effective, because that is something that is very widely misused, that term. Now, in general, pharmacoeconomics helps you answer several different types of questions. So that includes questions such as, is the added benefit of one pharmaceutical product or service worth its added cost, right? So that's incorporating, like we mentioned, both cost and outcomes as part of the decision-making process. It answers questions like, should we add or remove a medication from the formulary? What are the costs and clinical implications of adding or removing a drug from the formulary, which is kind of like the list of medications that are covered or within an institution? Should we reimburse for a product or service? And it helps answer these types of questions. And then if you're looking at it from a more service perspective, so if your options are between two services, should we implement a new service? So we're looking at what is the standard right now that we're doing. If we're going the second option, should we implement that? So it helps try to answer those types of questions. Now let's talk a little bit about the book itself. So the Art of Pharmacoeconomics is the first of its kind that really takes a macro level approach to the methods, skills, and personnel needed to perform and evaluate pharmacoeconomic analyses. Now, these are analyses, right? There's a very specific process about how you do these analyses. But like I mentioned, some of you will not be doing these analyses, but need to use them, need to be able to evaluate them. Because if someone tells you this intervention is cost effective, you need to be able to break that down to truly see if it is cost effective to you based off of your perspective, right? And so this specific book not only talks about the methods, but also who do you work with to get to either create these types of, or conduct these types of analyses, and what's the whole process. So if you are going to be doing these analyses, it really talks through about what are the skills you need, who should you work with, how should you work with them. I talk a lot about design meetings and what does that look like. So it gives you that overall perspective of who is working on these types of analyses, because a very diverse set of people work on these analyses. Now, like I mentioned, this is specifically pharmacoeconomics, but the methods in this book, regardless of what discipline is, will really help you look at it in various different lights in whatever area you are in. So let's get to a little bit. And so the book in general provides frameworks and tools, which I've created this pharmacoeconomic canvas, which is a great tool to allow you to kind of look at all the different elements that go into these analyses and help you evaluate these analyses as well. Now, there are several goals to me writing this book. Now, the first one is to really simplify a complex discipline. For those that are well-versed in the pharmacoeconomic world, you know that this is pretty technical, but allowing, to get really deep into it. But in order to allow more people to understand this, to allow more people to be engaged and look at these various different elements, it was important to simplify this complex discipline, to really break down the skills gap as well as the competency barriers that are faced by many healthcare professionals that want to incorporate a more evidence-based decision-making process to when they actually choose between their options. It's also to provide an essential beginner's fundamental understanding of the principles to articulate, work on, evaluate these studies, and then use these tools and information in practice and decision-making when needed. So again, I'm not advocating that this is used for every single decision. In the book, I talk a lot about when it makes sense, when it might not make sense, the limitations of those types of analyses, and so on. And so even if you are well-versed in this, being able to effectively communicate this to other professionals, which I've heard many people tell me already is one of the biggest struggles, is that they want to be able to communicate this in a simpler way to those that aren't as well-versed as they are. It'll also improve your abilities to understand, interpret, and critically evaluate the literature, which will actually assist us in translating the results of these analyses into practice and determine its relevance in healthcare decision-making. Like I mentioned before, the number of analyses has really grown. So we would like to also improve these types of analyses, provide higher quality, and have them be more useful in practice. And then ultimately, of course, you're going to see the world of healthcare decision-making a little differently. And then even it'll allow you to constantly question, is something really cost-effective? Now let's briefly go over the book. What are the sections and the chapters that it entails? So the book has 3 different sections and 7 chapters. So in section 1, this is where I talk a lot about decision-making and pharmacoeconomics. It really serves as a background and introduces the concepts of healthcare resource allocation, value, decision-making. I briefly went over it here. So it goes into a lot more detail, outcomes research in general, and then of course, pharmacoeconomic analyses and economic analyses. In section 2, that's where you get really to the hands-on, very detailed, kind of that holistic approach to these types of analyses in terms of designing, conducting, and evaluating them. It goes through the whole process. As well, it features different information about building a team, who you need to consider working with and why. And then, of course, the pharmacoeconomic canvas is introduced and summarized in detail. And then section 3 is just putting it all together, where you'll see the abbreviations, the references, and that type of thing. So who should read this book? Everyone really has the responsibility to ensure proper use of resources, because that is not limited to specific healthcare professionals. So that we know that it's a shared responsibility across all stakeholders. So whether you're a healthcare provider, whether you're a policymaker, whether you're a payer, and really society in general. So if you make any decision in healthcare, then this book is perfect for you. You do not need any prior in-depth knowledge or expertise in the fields, because I have simplified simplified it in a way that makes it very manageable to try to understand these various different elements. So it's truly designed for those across the spectrum. So it's designed for the students, residents, fellows, any healthcare provider and public health professional, as well as decision makers across the various areas. And we know decision makers in healthcare and across disciplines are very, very diverse. Now, of course, it's also for those self-directed lifelong learners who are really looking to broaden their scope of skills, really utilize objective methods, and discover what other skills they need. As I mentioned previously, because it's growing so fast, we're seeing a lot more in curriculum development and those that are seeing the need for more professionals to have these skills. Now, I had mentioned also before about that there's kind of two types of settings. In the traditional setting, as more of like a formal student, whether you are in a graduate school level and learning this in the classroom, you can use this. Or if you are already out in practice and want to understand these different elements so that you can make better decisions in healthcare, then this is also pertinent to you. Now, it's also pertinent those to across the spectrum. So whether you're in industry, whether in your academia, whether you're in health systems, whether you're in policies or organizations, right? Looking at these various different elements are really important. So the book itself is really used to learn the discipline of pharmacoeconomics and outcomes research. It's used to help conduct and evaluate these analyses to kind of go through that process, but it's also a great supplement to your existing pharmacoeconomic resources. This is to keep in mind there are resources out there, but this is very different in how the approach taken as well as the information provided. So it's a wonderful supplement if you already have something that you love, but you want to also try to think about it in a new way, think about how you're working with, who you're working with, and that type of thing. So that definitely provides different areas there. So that's my quick overview of the book. So we do have some questions, so let me get to that. And please feel free, if you have any questions, please throw it in the Q&A box right now, and I will get to that. Okay. So there's a comment here. So it says, while I wholeheartedly agree with this philosophy, finite resource model, I still have not seen our system behave in that fashion. Mostly the system has found ways to stall care or make it administratively challenging to get, but rarely taking a stand on determining that high-cost therapies are of insufficient value and create blanket exclusions of these technologies. From your research, do you think that the arc, or in terms of years, is for the intersection of a broadly deployed pharmacoeconomic-based rationing of care? So thank you for that. And this question is more tailored to kind of a US health system. So I think, I don't think it's going to be broadly deployed as a rationing, I do not believe that it'll be broadly deployed, that we are not going to use pharmacoeconomics kind of as a broad base, especially early on. Now, depending on where you are in the world, and so the clarification of it being US based is important, because if it's already being used as part of our decision-making process, and in many different institutions, it is not. So to be able to be broadly used is going to be quite difficult, but understanding its role within our decision-making process and incorporating it as one of the elements is going to be really important, because it draws that culture around determining, are we putting things towards high value or low value? So the attendee made a great point in terms of, you know, are we going to high cost therapies of insufficient value? So are we thinking about what does value mean? And so in this book, I do talk about what does value mean, and then how people define it very differently. There's different types of frameworks as well. And then to start thinking about high value versus low value, what are some examples? And then incorporating, because what pharmacoeconomics will start getting people to do is, as we're thinking about allocation, is where's the value in that? So I think the broadly deployed is going to be difficult depending on where you are. I think the US is still going to be difficult to be widely deployed because it's still not being even used as part of the decision-making process in different areas. But I think, to your point about understanding that it can play a role in determining where is the high value, where is lower value, how are we allocating to best ration the care. So I hope that answered your question there. So I do have a question about those within industry. So how do you foresee this type of information being used in industry? So that's a great question. So if you're within the industry setting, whether it be like pharmaceutical, no matter where you are in kind of that the drug approval process, if I'm assuming here's drug approval, but even if you're in the medical device, right? Constantly thinking about how we deliver the messaging, which we talk about in the book in terms of how do we deliver the message of whether something is cost effective and what that ultimately means. Because, you know, I talk a lot about in the book about perspective is half the battle. And when we're delivering those types of messages, either to healthcare providers or the patients or those that are ultimately trying to, you know, would benefit from the medication that we are creating and providing, or those that will be paying for it, right? We have to be able to effectively communicate that. And if we're all trying to look at it as a system of parts of the various different elements that go into it, we all benefit by being able to say, well, now I'm thinking about it from a payer perspective. What are the different costs that they think about? What are the different elements? What are the outcomes that they think about? And so being able to design that is really important, because when you have those fundamental frameworks or those tools, which like of the pharmacoeconomic canvas kind of gives you that basis for that, then you can start to say, okay, how do I best deliver those messages? How do I think about costs within what I'm doing? But then ultimately, who's the decision maker? And then how will they take this uptake of this information? And what's so interesting about, and I talk a lot about it in the book, is that, you know, you need to determine how you'll use this type of information, right? These aren't these types of information that is just a nice to know. If you're doing it as a nice to know, it's a very long process, because you need to know what will you do with that information. So if you determine between two or more choices that maybe one is more cost effective, will you be able to implement and say, I want to decide on this? Or would, you know, or are you, because there are certain cases, well, you will pay for something regardless of if you deem it cost effective or not, right? Due to ethical reasons, for society, that type of thing, kind of different decision-making criteria. So it'll help you decide, you know, when I do start looking at something or thinking about something, how will these types of decisions inform my decision-making, you know, or is it something that I'm just more curious about? And it's also kind of difficult to do these types of analyses in general when you're comparing across countries, because what's cost-effective in one country might not be cost-effective in another, or in even a region or a specific population, right? And really looking at specific disparities even within that. So I think that's also really important to note. Any other questions that we might have? Let's see if I might have one in the chat. Okay, so here's another one. Do you believe that the role of third parties, so organizations such as ICER or NICE, and so that's in the ICR is here in the United States, NICE is in the UK, will be in the future? So what's their role of these third parties in the future as an arbiter of pharmacoeconomics between industry and payers? So I think these organizations, I mean, so for those that aren't familiar, there's different types of organizations. So like so NICE in the UK, you know, provides a lot of guidance, and even ICER. So there's different organizations, and I talk about them in the book too, as different examples, kind of as resources you can have, but that either they're great at looking at these types of analyses and making recommendations. So based off of this, and given their expertise in the specific areas, this is what we might deem as cost effective or not, right? And so these organizations are actually playing a more significant role, because people are looking to a specific organization that's either compiling all of these resources. So I know like Tufts also has one where you can go and you can see all the different types of pharmacoeconomic analyses, so you can search those and then see how you can best utilize those. So I believe that with the more that we use and understand these types of analyses, the more that we're seeing, and the role of these organizations are going to be much larger, because you sometimes need those kind of organizations that tailor or communicate to a specific way, whether it be industry or payers, or kind of connect the two. So how is it maybe applicable to this industry, and then how is it applicable more towards the payers? And also not just industry, payers, health systems, providers. And so we're going to continue to see those types of connections there. So thank you for that question. So we are at time, and I do want to respect everybody's time, but I do want to thank you all for taking the time to be with me today to hear about it. The book, if you are interested in it, is available on Amazon. If you have any additional questions, there is more information about the book on our website, so salsvitegroup.com. But if you do have any specific questions, you can contact our team at contact@salusvitegroup.com. So thank you all again. And if you do get the book, please send me a note and let me know what you think. So thank you to all that asked questions and that attended today. Thanks so much.